In July 2023, Dr. T.J. Bolt kindly walked through a revised version of his pre-exam interview presentation to demonstrate how he uses this presentation with his patients. BiteFX Premium members will find this presentation in the detailed presentation set of templates. This is one of a number of videos we've created based on conversations with Dr. Bolt. If you haven't already seen them, you might want to watch two other videos before this one. They are The Secret to Success with BiteFX and Pre-exam interview tips. These videos put what you are about to see in the context of TJ's overall philosophy. Now over to TJ.
When I start to use the BiteFX, I've always sat down and asked the patient when they our first meeting what it is that they hope that I might be able to help them with. So in other words, when they call up on the telephone and they made an appointment, what would make you happy if I could help you with whatever? So I always start with goals. They share their story about what's going on, and then I ask them if they'd like some information on what is going on with them as it relates to temporomandibular joint disease or myofascial pain dysfunction syndrome. So then I begin by helping them to understand that when a person has temporomandibular joint disease, it doesn't self-correct itself. It only continues to get worse. But why don't we just begin by explaining what a temporomandibular joint really is? So everybody's got two of them, one on each side. You have a lower jawbone, you have an upper jawbone. You have a piece of cartilage that separates the two bones. There's a ligament that attaches to the back of the piece of cartilage down to the end of the lower jawbone called the condyle. Then we have two muscles. One goes to the lower jawbone, the other goes to the front part of that piece of cartilage that's in orange. And then the whole thing's surrounded with a sac, and fluid flows in and out of there called synovial fluid. It's kind of like lubricating oil. So that's really what a temporomandibular joint is. It's a very unique joint. It's the only one like it of its kind. The second thing I wanted to show is where the ear is, because a lot of patients are referred by ear, nose, and throat doctors, and they have absolutely no idea why they're coming to me a lot of times with TMJ problems, because their ear hurts. So I explained to them that there's a nerve that passes in front of the ear on its way back to the brain, letting the brain know that something's not right in the joint area. The body is always built to last. The brain always knows when something isn't right. So this disease takes many, many years to start to form, and a lot of times people have signs, they have symptoms, and then once the frank disease comes about, now breakdown occurs, and this is usually when they start to feel it. Pain is the last stage of the disease process. There's a nerve that passes in front on its way back to the brain, letting the brain know that something's not right here. And many times what happens is that nerve is firing, and just like referred pain is what I'm explaining here. That nerve is electrical impulses, and when it's hyperactive, it gets all the other nerves in the area hyperactive, and that's what sends out that referred pain. Many times, like a person who has a heart attack, saying that their left arm is hurting them really bad. It's not their left arm that's hurting, it's the fact that they're having a heart attack because of the brachial plexus being very close to the heart. When those nerves are firing back to the brain gets confused over where that message is coming from. That's the reason why ear, nose, and throat doctors are sending people in, because a lot of times the patient will then say, you got to be crazy because my ear hurts and you're telling me there's nothing wrong. How can it be anything else but that? That's how. Okay. So when I open and close this, what I'm explaining to them is that in an ideal situation, the front and back teeth will touch at the same time and the forces will be evenly distributed throughout, while the lower jawbone is in the midmost uppermost position of the upper jawbone. The only time that that happens is 12 to 2,400 times a day when a person swallows. Then I go on to the next. Now we got muscles that are coming in, and I'm explaining to them that in this particular animation, there's muscles of mastication and muscles of facial expression, and they talk to each other. So when we have aches The only time that that muscle is supposed to fire is when we're closing down and when all the teeth come together, 12 to 2400 times a day. When we're eating, those muscles are skeletal muscles, and they're just like muscles in the arms and the legs. They're designed to do work. There's sensors in between the root of the tooth and the bone that let the brain know what is in between the teeth. The teeth are not supposed to touch at this time when we're chewing. Those muscles can contract between 0 and 90 pounds per square inch of pressure. So when you're eating a piece of steak, the muscles are told to contract at 90 pounds per square inch, scrambled eggs about 20. And how do they know that? Because of those sensors in the teeth. But at this point, the teeth do not touch when you chew your food. Remember, the only time that they touch is when you swallow 12 to 2400 times a day. Any other time that the teeth touch is called a parafunctional habit, and that's not good. At night while you're sleeping, your muscles, when your subconscious awakens and your conscious goes to sleep, those muscles can contract 3 to 4 times greater pressure than they can during the day. So a lot of destruction occurs during that time. So we've now covered teeth, we've talked about muscles. Now we're going to talk about the joint itself. So this joint is, like I said, very unique. So when a person gets ready to open their mouth, the reason why they're doing that as far as it's concerned with chewing is so that you can get your mouth open wide enough to be able to put something in there so that you can close and bite the food off with your front teeth. Those are called incisors. Notice that this piece of cartilage is separating the two bones. Notice that this muscle down below is contracting when you open your mouth, and when you close it, the lower muscle will relax and the upper one will fire. This ligament back here is attached right there, and it's always tight. It's like a rubber band. It can expand, but it'll always want to contract. And the muscle in the front, called the lateral pterygoid muscle, the superior border is now contracting so that it'll hold this piece of cartilage tight, so that when the lower jaw then comes closed, that piece of cartilage is now the thickest piece is separating the two bones. So it's a finely tuned machine. Now, when it starts to break down, things occur. Here's why you might have a click or a pop. So when this lower jawbone, notice that the lower jawbone is a nice round ball, but when you look at it from the top, it's a big thick bone and it's beveled downward. So the thickest piece of cartilage is on the outside, called the lateral pole. As it migrates into the skull, it thins out. So it's beveled downward, so the thickest piece of cartilage is on the outside, called the lateral pole, and it takes a lot of force to tear that off the top of the lower jawbone. And it always starts to rip off on the outside and then progressively gets worse through time, and it's starting to continue to rip off until the whole thing comes off, and that's called a complete anterior displaced disc. So what we'll do is we'll look at it. So where the clicking and popping comes from is when that starts to rip off the top of the lower jawbone, because this superior border of that muscle is firing when it's not supposed to. It causes it to rip off the lower jawbone, with the lower muscle pulling the lower jawbone forward to open the mouth, runs into this piece of cartilage, and if it reduces, it's going to flop back up on the top of the lower jawbone where it came from now, because it caught up, because the lower muscle is firing and so is the upper one, and it allows that lower jawbone to catch up to this piece of cartilage, making a noise. Now, just because the noise goes away, because it can come and go, does not mean that the disease has diminished or completely gone away. As a matter of fact, all it means is that the upper muscle has pulled that piece of cartilage more forward and ripped off some more, so it doesn't catch up to the lower jawbone anymore, thus not making a sound. If it locks and a person can't open their mouth, the lower jawbone runs into that piece of cartilage, and the piece of cartilage blocks its path so it can't move. If you open your mouth and then you can't get your jaw closed and your teeth can't come together, that's called an open lock, and that's because the piece of cartilage now flops behind that, blocking the lower jawbone from going back up into the space that it normally would. So there's two different kinds of locks. All right, so we've talked about the disease now. So some smart oral surgeon from Clearwater, Florida, St. Petersburg area, invented 5 stages of joint disease. So we're going to see all 5 going through the stages. Now, the problem that I have is that I can't tell you how fast this is going to go. So if it's just starting out where it's pulling off, it could take years for that to come off, or it could be the next day where it all came off and the whole thing would be a complete anterior displaced disc. The message here is that the progression of disease continues unless someone helps you stop it. It doesn't self-correct itself. It only continues to get worse through time. So a little bit of disease leads to a little bit more, to a little bit more. So here's the progression. Notice that the upper muscle is now pulling the disc off. Now we're getting some popping and clicking occurring, and it'll continue until the whole thing continues to get pulled off and herniated. And it just keeps ripping the thing off until finally the whole thing pulls off. And now we have a complete anterior displaced disc. Now, when this happens, there's no way to help this without a surgical intervention. But there are oral surgeons. The one that I refer to only operates probably on 2% to 6% of the people that come in to see him with this thing going on here per year, of all the people that he sees, because something bad can happen that is probably as bad, if not worse, than the disease progression itself. It doesn't happen to everybody, but one of the side effects that can happen as surgery is once you cut that sac open, you can introduce osteoarthritis, and that can cause some problems itself. And so it's not a lot of times worth the risk unless it's really, really severe and the person has no other course of action but to undergo that surgery and just take the risk of having osteoarthritis set in. So the idea is that we want to catch this before it gets to this point, because notice that the bone just starts now to break down and it starts deforming over time. All right, next. Now we're going to talk about the rest of a good bite. What's in a good bite? We said that all the teeth come together at the same time with equal intensity and the forces are distributed about while the jaw is in the midmost uppermost position of the upper jaw. When we get ready to open our mouth to be able to tear the food off and bite the food off, the jaw is going to open, and then we want the 4 lower incisors to touch the back of the upper 2. Notice space between the back teeth. That's very important, because if the back teeth touch at any of these points that I tell you about other than straight up and down, it's going to cause the elevator muscles to fire when they're supposed to relax, and you're going to overload the whole system, which will destroy teeth and will overload the jaw joint, causing destruction of the temporomandibular joint. So space between the back teeth. Now the food is torn, and now it's going to come back to the grinders. And as it comes back to the grinders, we want the jaw to move out so that it's going to move laterally or sideways, depending on what side the bolus of food is placed, the majority of it. And the jaw is going to swing out, and it's going to deflect off of these 2 teeth called the cuspids. Notice that the back teeth are separating, and then the jaw is going to move back and forth, and the points on the teeth are going to push the food up into the grooves of the teeth, the ridges of the teeth, and that's how we start to chop up and prepare our food for digestion. Now, what happens when the back teeth get caught and interfere in that, the back teeth are going to bang into each other, causing an increase of elevator muscle power, and it's going to start banging the root of the tooth into the bone, causing the bone to start to become traumatized, and it breaks down, and once it's gone, it's never coming back. And it'll keep doing that until more of the root of the tooth is outside of the confines of the bone, and the tooth becomes flexible. And when it does that, you're going to blow the enamel off the side of your teeth, and that's called an abfraction. So if you hear me say abfraction in the exam, you'll know what I'm talking about here. That can cause sensitivity to the teeth a lot, or a person won't even know that's happening. It just depends on the nature of each individual patient. Now, what we'd like to see is all the contacts. If I put carbon paper in between your teeth, this is what we would want it to look like. We'd want the points to be in the grooves. So here's the lower, and if we allow it to continue, it'll show the upper. The lower jaw contacting the upper, so we want all those teeth gently touching each other. Notice that the points are very, very small because the points on the teeth push the food up into the grooves, and that's what causes the chopping of the food. So if we have too much touching, like in this next animation, you're going to notice that we're flattening out the teeth because it's simple physics. We're going to wear the teeth down. So just like granite, the only thing that can scratch granite is another piece of granite. Well, the only thing that can destroy teeth is either acid or one tooth rubbing against another, because enamel is the hardest thing in your body. And once you start to break it down, it wears away from the forces that are going on. And if we have one tooth banging too hard on another tooth, that tooth is just going to move away from the insult. Simple physics. Wherever there's an action, there's an equal opposite of reaction. Now, one of the things that I look for when I'm doing this examination is what we call a slide. So sometimes the back teeth will touch the back teeth, and then the muscles are going to drag all the teeth into position. Look what it does to the lower jawbone. It pulls it out of the socket, and with that, it causes this to come, the disc to get pulled forward too. So every day swallowing 12 to 2,400 times a day, plus if you happen to be clenching and grinding your teeth, if this is going on, you can see why your teeth are wearing down, and you can see why you have that trauma being exerted up into that joint space, causing inflammation, which is what's giving you the earache or causing that pain up in that area. So the teeth can get sensitive, they can wear down, muscles can overwork themselves, and when the muscle overworks itself, there's two energy sources inside of a muscle. There's fast acting and stored. In our facial muscles, we're not supposed to be burning the second energy source, but it's available. Just like in a skeletal muscle, in the arms and the legs, that muscle in your face is a skeletal muscle as well with two energy sources. If we burn that second source, the stored energy, the byproduct or the waste product is lactic acid. When lactic acid is in the muscle, it's going to make the muscle sore, and that's what's going to be giving you the headaches or the facial muscle pain. This is the way we want all the teeth to touch again, just like that, and not that slide that you see. So there's 4 reasons why people will lose teeth as a result of a bad bite. Remember, the first 2 were tooth decay and gum disease. Those are diseases of choice, but this one you can't do anything about. The left animation is normal, the right animation is abnormal. So what's going to happen here is you're going to create microfractures inside the tooth, which is going to allow bacteria to get in there, and it's going to kill the nerve. So some people either get hypersensitivity of the tooth, so it's going to hurt to cold because you're causing that nerve trauma and it's going to become hyperactive, or you're going to kill the nerve. And the reason why we kill the nerve is because of those microfractures that are caused in the tooth itself, and it opens up the outside of the tooth to the inside of the tooth, and it'll cause that nerve to die. The next one, if we move it along, will cause wear of the teeth. So you can see it wearing. Or we're going to cause it to move. And that can cause sensitivity of a tooth as well, because you're bruising the ligament that surrounds the tooth, or you're going to move it again and you're going to cause it to blow the enamel off the side of the tooth, or you're going to cause it to crack. So the reason why you might have had that crown placed because you broke a tooth didn't happen by accident. This is the progression of disease that we're talking about. So if we see any of these things at all, not today, but a different day, I would ask you to come back and return, and I'm going to do a deep dive into this and collect information by taking molds of your teeth and putting it on this chewing simulator, and I'm going to study it, and then we're going to get back together and we're going to talk about what we can do about it. The reason why I don't do it today is because I don't want to, if you're just here for information, I don't want to be going through all of this work if you really don't have any interest, because I don't want to waste your time, my time, or your money. I want to make sure that you're really serious about trying to get to the bottom of this, so we schedule it a different day so you don't feel like you need to be doing this. Do you have any questions on any of that? Then we're done for the examination. Okay, now I'd like to invite you back. I didn't sit you in this room so that I could show you that I was the smartest person in the room. I did it so that you could see what I was looking for. So if you have any of this, you'll know where I'm coming from. And if you're interested, then we can dig deeper into this. And the whole purpose of this examination is to help you make good decisions for yourself.
I hope you gained some great tips from Dr. Bolt. If you want to hear more from TJ, subscribe to our channel or ask us about gaining access to some of his webinars.